Welcome to the fifth podcast in our series on the management of COVID-19 in rural and remote settings. As you may recall, in our last podcast, we outlined a procedure for assessing patients presenting with suspected COVID-19. We identified the initial assessment should include documentation of the patient's presenting symptoms and history of their illness, their past medical history, medications and allergies, that we should also in addition perform a set of vital signs to assess the respiratory rate, oximetry, pulse, blood pressure and temperature, and in patients with saturations less than 90%, we should apply nasal spec oxygen in the range of 2 to 6 litres a minute. Another important step in the assessment of these patients involved obtaining IV access and obtaining blood samples for bedside testing and laboratory testing. We identified that medical assessment focuses very much on assessing the patient's respiratory status in order to identify whether admission, oxygen or even ICU level care would be required, and considered alternative diagnoses. The medical assessment was characterised by a minimal hands-on approach, looking to avoid unnecessary ENT examinations or auscultation of the patient. We identified the importance of ultrasound in the assessment of patients with suspected COVID and identified the ED workup including chest x-ray and laboratory testing and the possibility of bedside COVID testing in the near future. In this podcast, we will continue our discussion of assessment and immediate management of patients presenting with suspected COVID-19, focusing on personal safety and the use of PPE. As always, the first step in the management of any patient is to ensure your personal safety, and in this situation, we need to check that we've applied PPE. PPE should include a gown, gloves, and eye protection. Provided the patient is not receiving oxygen, it is appropriate to use a surgical face mask. In addition, the patient should continue wearing their face mask. If the patient requires oxygen or the patient is already receiving oxygen, an N95 mask should be placed to protect you from aerosol dispersion of COVID that occurs with the use of oxygen. Before discussing management of the patient presenting with suspected COVID-19, let's focus on management of your personal safety and take this opportunity to review how to put on or don PPE and how to remove or doff PPE. While it is certainly important to correctly apply PPE, it is equally important to ensure we carefully remove our now contaminated PPE afterwards to ensure we do not accidentally expose ourselves during the process of removing our PPE. For this exercise, we'll be following the CDC guideline. Recognise, however, that there are minor variations in practice and you may have been shown something slightly different. The principles should, however, remain the same. If you follow a specific method that is covered in an alternative video, you are welcome to use this resource to review the procedure. What I would definitely encourage you to do is to practice, practice, practice. This is often best done where possible with a colleague who can either coach you or observe and provide feedback to you as you go through the procedure. Take the opportunity to do this whenever you're in a situation of having to don and doff your PPE in your normal work practice. Have someone provide you with feedback as you don and you doff the PPE, as this is extremely helpful and may prevent you in the future from becoming ill after being exposed to COVID-19 or other infectious disease. Let's begin by running through the sequence for putting on personal protective equipment or PPE. Natasha will now demonstrate the don and the doff process. The gown should fully cover the torso from the neck to the knees, arms to the end of the wrists, and wrap around the back, and we should be able to fasten it around the neck and the waist. We can see here how Natasha demonstrates to put the mask on. She grabs the two ties with her fingers, places the mask under her chin, and then lifts the mask over her head and places it over the face. She then checks to make sure that it is sealed. We then need some eye protection. If, like Natasha, you have no glasses, then goggles are used to protect the eyes. If you wear glasses, this involves placement of a face shield. Now that we've completed putting the gown on, the mask and tested it, placing the goggles, the last step in this process is to put gloves on. We've identified the importance of being careful when you remove your PPE. The aim here is to avoid contaminating your clothing, skin or mucous membranes as you remove your PPE. Remember that you should remove all your PPE before exiting the patient room except your mask. You remove the mask only after leaving the patient room and closing the door. Begin by removing your gloves. Remember that the outside of the gloves are contaminated. Use a gloved hand, grasp the palmar area of the other gloved hand and peel off the first glove. Hold the removed glove in the gloved hand. Then slide the fingers of your ungloved hand under the remaining glove at the wrist and peel the second glove off over the first glove. Discard the gloves into a medical waste container. Next, remove the gown. Again, the gown front and the sleeves should be considered contaminated. Unfasten the gown ties at the back, taking care that your sleeves don't contact your body when reaching for the ties. Pull the gown away from your neck and shoulders, touching inside of the gown only. Turn the gown inside out, fold or roll into a bundle and discard into the medical waste container. Next, remove the goggles or face shield. Remove the goggles or the face shield from the back by lifting the headband or the earpieces off. Finally, remove the mask after you've left the room. Remember that the front of the mask is contaminated. Using your hands, untie or lift the bands holding the mask from the back over the top of the head, avoiding touching the front of the mask. Between each of these steps, you should use hand hygiene. So remember always to perform hand hygiene between each of the steps as you remove personal protective equipment. This concludes our podcast in which we focused on the application and removal of PPE. In the next podcast, we will explore the management of respiratory distress in the patient with COVID-19. Always remember that no matter where you work and whatever your background, your skills and your knowledge can benefit the lives of your patients, their families and communities in ways far too great to measure. What we do matters.